doctor, previously known as area medical officer. So the main role is school vaccination and childhood assessment clinic. But I was kind of asked to do health screening for asylum seekers and refugees in the Midlands. So we cover 4 counties there: Leach, Offaly, Longford, and Westmeath. A team of 2 people, a nurse and myself. Right? The nurse was here the last time, but she didn't come along this time. No, I'm sure everybody
make no assumptions.
I'm sure everybody heard about asylum seekers and refugees. So in the newspaper or in the media or whatever, people say, yeah, anybody that is displaced or whatever are known as refugees, but they're not. There's a definite term for refugees. Okay, the United Nations 1951 Refugee Convention, and to be declared a refugee, you need to be, someone who has been forced to flee his or her own country of origin because of a well-founded fear of persecution for reasons of 5 things: race, religion, nationality, political opinion, or membership of a political, a particular social group, like lesbian, gay, bisexual, those kind of things. Okay. So in order for them to qualify as refugee, they would need to come under those 5 categories. Okay. And then, if they don't qualify as refugee, then they can apply for a thing called subsidiary protection. Okay. That was brought in 2013 by the European Union. And to qualify for that status, then they would have to be have a belief that the government has to have a belief in this person having concern if they return back to their own country would face a real risk of suffering serious harm. Okay, so that would include death penalty, torture, inhuman treatment, or serious risk to their civilian life. Okay, I'm sure you heard about direct provision and been well criticized. There are pros and cons of direct provision. For example, at the moment there are about 120 people coming into the country every week. So there's a massive increase of people. The direct provision sites are totally full, and now to cope with the accommodation thing, the government has opened up emergency centers located normally in rural areas where there are no facilities there, no schools, no GP services, no transport system. So the system is overwhelmed. And as regards to direct provision, everybody heard that on the news or on geography or whatever that it is like a prison. I work in direct provision. I provide healthcare services there, right? I do health screening on them. It is not like that, actually. They get free accommodation, they get 3 meals a day, and it's not a prison. They are allowed to come and go. And anybody who wants to apply for asylum, they have a choice of whether they want to stay in direct provision, or they can, do their own private rental, or stay with relations or friends or whatever they have here in Ireland. Now, people coming to Ireland here, seeking asylum, they are not people that, you were on for humanitarian aid. The people that came here have a lot of networking done, research before they come here. So they know where they're coming to. When they come here, they get free medical aid, they get free medical card, they get access to all the social services, they get free legal aid. So they're very well cared for. So, like I say, it's my own working perspective. Some people might have it, and quite a lot of people that came here because they want to get their children educated. Great majority of them are economic migrants. Certainly there are people that would need help as regard to being a refugee, that's for sure. But they are kind of a small proportion compared to the general amount that come here as economic migrants.